Welcome to the recorded version of Helping Seniors with Loss of Independence, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
And our presenter today is going to be Dr. Amy Dupree. Dr. Dupree, a gerontological social worker, is an internationally renowned expert on lifestyle issues relating to caregiving, retirement, aging, and family dynamics. Dr. Amy Dupree is president of Essential Conversations, Inc. and Dr. Amy, Inc., a company dedicated to family caregiver wellness. Dr. Dupree holds a PhD and master's in social work, specializing in gerontology, and she earned her CSA, a designation for which she also trains others as part of their accreditation. Dr. Amy Dupree is a much sought-after speaker at corporate and professional events on the topics of caregiving, aging, and retirement, and she is also a frequent guest on radio and television. And with that, I would like to welcome our presenter, Dr. Amy Dupree. Welcome, Amy.
Thanks, Steve. I appreciate it. And today we have a topic that I think is of interest to a lot of us who work in the field, and that is this idea about, how do we help people maintain their independence? And what we're going to do today is we're going to talk about it from the standpoint of how we as professionals can help family members recognize the signs of aging in their parents and also obviously identify possible needs for additional care and services, and of course also just the older adult themselves, and then support them so that they do stay independent. When you think about that word home, that one word can conjure up all kinds of good feelings. For most of us, it's things like safety and love and warmth and family. It's the place where we want to be, where we're most comfortable. So I don't think that first bullet point will surprise any of us that nearly 90% of older adults would prefer to stay at home as they're aging, over 90%. And I think that would probably be true for a lot of us as well when we get to that stage. So as you know, there are a lot of good reasons that people may want to stay home, and we know that one of people's biggest fears as they age is losing their independence. And the other thing is they don't want to be a burden to their families. They want to maintain their current lifestyle. So all of that has to do with what we're talking about here. Now, the downside of that is that because of those desires, we know that people often end up denying a real need that exists for care, and they sometimes make bad decisions, all in the name of staying at home. I always talk to people about how to make sure that your home stays your palace and doesn't become your prison, because that's a big issue for a lot of people when they're not making good decisions around that, and they're really no longer able to do things in the same way they were. And that's why it's important that as we're working with family members, for example, and also working with older adults, that we really help families look for warning signs that their parent may need help, that we really encourage the older adults to take a very active role in their own lives in this way and be able to be realistic about when they do need help. Because we know that ignoring warning signs will likely lead to the kind of dependence that they're actually trying to avoid. So it's counterproductive. Okay, so let's talk about specifically what we're going to discuss today. What we're going to talk about is we're going to talk about these various categories and these signs that caregivers can look for. And the signs fall into these three categories. So physical symptoms and mental and emotional changes that occur, that's one category. A loss of attention, we're going to talk about that when things start to impact their lives because they're not able to attend to things. And then environmental clues that families can look for and as they're assessing this. And then we're going to discuss a number of ways that caregivers can take action to ensure that their aging parent has the assistance they need to live safely and comfortably. This is a great time of year to be talking about this because it's right before the holidays, and it's likely that many of us are working with families that will be gathering and spending more time together, and this is a good time for people to really be aware of what's going on with their parent so that if there are changes, that they're staying on top of these. It's also a great time for older adults to just be more aware of changes from last year and things that they need to be aware of and attend to. So let's start by looking at some of the emotional and physical symptoms that can really alert us to some problems with an older adult. So you've got two categories of symptoms here, the emotional and the physical symptoms. So these are some things that you can ask the family to really watch when they're now with their older parent. For example, do they notice that their parent now seems tired all the time? Are they noticing that they just lack the energy that they used to have, and there's a big shift in this? When they call them, are they waking them up from their nap all the time? You know, there's nothing wrong with napping, as we know, but what we're looking at here, as you can see, is persistent fatigue and loss of energy. And so these are very important signs to look for. We know that those are just two of the physical signs that somebody may be struggling and may be in need of extra attention. And as you can guess, these signs can be caused by lots and lots of different things. But it's important to notice them because they're key symptoms to watch for as people start to have issues around their independence. So the thing about these symptoms that we're looking at here is it doesn't take a lot of time to figure this out, and a lot of the symptoms can even be picked up over the phone, so it doesn't have to be that people are getting together. So a family member can ask their parent, you know, how are you feeling? Are you still going out with Joe every Friday? You know, I know with both of my parents, as my dad got older and he was a caregiver to my mom, but after she passed, he had a real routine in the people that he saw, what days he had lunch with somebody or what day that he got together with this widowers group. And when he didn't do those things, I knew something was really wrong. So watching for the change in the routine is very key, and asking about just questions about socializing and what are you doing and what's going on. We can teach families to pick up on a lot that way. You know, if the person attends religious services, you can say, you know, you still going to church on Sunday, and you still meeting those people that you usually go out to brunch with after church. Those are key questions that will help families start to look at what might be going on if there's a problem. And we know that if there is a shift in this, if they've lost interest in socializing or they stop participating in hobbies that have been important to them, then it could be a sign of depression. And I think especially as we're working with families, we need to make them aware of this, because I think we miss so much depression in older adults because we don't pick up on the cues and we don't ask the right questions. And it just takes some tuning into. And the other reason I think we miss it is often the changes are pretty gradual. And so people don't realize that their parents becoming more and more depressed. Now, it's not just depression that could be an issue, obviously. It could also be a physical health issue that's going on that's causing them to back away from things. I know when my father did start shifting in some of the things he was doing, it was because his macular degeneration had gotten worse and he was having trouble driving. And that was my first clue that it was getting more severe when he stopped socializing because he couldn't get places. So those are things people need to look at. Is it a physical or an emotional change? Now, sometimes the signal that the family gets is pretty drastic, and there can be a major change in mood or a major change in their outlook in some way. So if the parent goes from happy to crying in seconds, or are they coming across very irritable and grumpy, and notably so? And I have a friend who's going through this with her mother right now. Her mother's always been a very gentle, kind of quiet, very sweet-tempered woman, and the daughter says she just explodes at the drop of a hat, and she just doesn't know what to do with it because it's so unlike her mother. Well, her mother's having a chronic pain issue and hadn't talked to her daughter about how bad it had gotten until her daughter finally said, you know, Mom, I just find that you're not really yourself. I've never known you to be short-tempered. And when she talked to her mother about it, they finally were able to have a conversation, and the daughter learned that the mother is trying not to burden her. So again, not ignoring that sign is key. The other thing we say to families is they should keep an eye out to see if those symptoms persist over, days or weeks. They might also check with friends or neighbors or anyone else to see, are they noticing those behavior changes as well? So, getting some other data if you start to notice changes is a great way to go. Now, that's on the emotional side. Let's talk on the other side of that slide, which is the physical things to watch out for. So they really want to make sure when they're visiting family, older adults, when people are getting together, they should look about things like balance issues, changes in gait, loss of appetite, and weight loss. These are 4 really, really key things. If balance has changed, as you know, this can be a very serious thing because it can often lead to falls for people. So they should know, do they have trouble getting up from a chair? Or when they stand up, are they unsteady for a period of time? And for those of us who've worked in the field a long time, we know that those balance issues can lead to falls that can lead to major problems. So it's important to be very aware of those changes and if there needs to be any adaptations done. Not just for the standing, the second part about changes in gait are really important. Do they have to balance themselves as they walk room to room by holding on to furniture to get from one place to the next? Are they able to stand and be steady? If somebody notices that their aging parent has difficulty with mobility, they should really take a close look in the bathroom at things like the towel bars, the window sills, or the shower curtains. Are they seeing signs that they're grabbing those things to balance themselves? For example, you might notice that the towel bar has been pulled away from the wall a bit. That's one of the key signs with that. Or the shower curtain's torn because they've grabbed onto it. The other thing that we see happen a lot is that people start to have trouble getting off the toilet because their leg muscles get weak, and they may have sort of a several-step process they use to get up, which is grabbing one thing and then another thing. And so taking a look at that is really important. Another physical symptom of some underlying health issues, and also could be an emotional issue, is clearly a loss of appetite and weight loss. So if the family member is hearing, I'm not hungry, more and more often, they really should address this issue. They should also check over the grocery list. Is there more junk food or items that are easier to prepare but they don't really have any nutritional value? These are important things because all of that can lead to a significant issue with proper nutrition that can lead to serious health issues. You know, one of the problems we know that occurs in older adults is that they can become underweight, and that can be a great problem as they're, you know, as because they don't have the reserves they need in order to fight things off, and they don't have the physical strength to deal with issues. So this being underweight is often not a good thing, and it's often accompanied by changes from muscle mass to more body fat, and even if they're not overweight, and this idea of sarcopenia, which is, you know, an overall weakening of the body. And these things start with very subtle cues, and those subtle cues are things like, I'm not hungry, and I'm, you know, and you see there's no food and they're not eating. So it's important, I think, for us to talk to family members of older adults and say to them, you know, you really do need to look for these physical and emotional signs, and they are tough issues to face, but you don't want to ignore them, because if you ignore them, they're likely going to get worse, and they can be dangerous, and they can be costly to this person they love, both in the sense that it may take longer to recover from it, and they may lose even more independence. So as you know, those aren't the only signs of aging. So let's take a look at some other signs now. We're going to talk about loss of attention signals and environmental clues. Okay. So you see there the loss of attention, and we've got 3 categories here, as you can see: appearance, driving, and concentration. So let's start with the appearance one. This is probably the most obvious one for people because they can see it right away if they're visiting. Is clothing dirty? Is it unkempt? Are they starting to neglect their personal hygiene? If their daily grooming habits do seem off, that can really be a notable sign of depression, dementia, or another health issue. So again, I noticed after my mom passed and my dad was living alone then, and I noticed when I was visiting him that he didn't look as clean, and he also didn't smell as clean. And my father was quite depressed for almost a year after my mother died, and I talked to him about this and said, you know, I'm concerned because I'm noticing that your clothes aren't as clean, and I'm guessing maybe you're not showering as much as you used to. And my father, as he moved out of that depression, started to regain his typical grooming habits. Now, again, because my father had macular degeneration, sometimes he missed a lot of things about appearance of both the house and his clothes because he couldn't see it. And that was another sign to me when his vision got worse. So those are all things that we need to teach people to tune into, and we're going to talk in a few minutes about how do you handle these things. But right now the key is let's not ignore them because we don't want people to simply think that this is all a normal part of aging because it is not. And I think we're still in a position we have to educate people so much about what is and isn't normal aging. Okay, so that's the appearance, the driving. I don't need to tell you this is a tough one for people. Talking to family members about driving is not easy. If the older adult is still driving, it's a great idea for family to go for a ride with them to see what's going on with their driving skills. Is their response time slow? Are they rolling through stop signs? You know, there's other warnings of things too. Obviously, if they miss the turn because they can't read the signs, or if they're braking quickly, or simply if you go out and look at the car and the car has a lot of damage, you know, just that clearly shows there have been fender benders or parking too close. And I know how hard this issue is for families to deal with, but we don't want people ignoring this. Because of my father's macular degeneration, every time I would visit, because I lived long distance and I was there several times a year, I would talk to my father about this. Was it time for him to stop driving? And he would tell me, no, it wasn't. And, you know, I'd go out to the car, and one time I went out, and there was a crease down the entire length of the car. And I said, Dad, what happened here? And he said, I guess I parked a little close. Well, what clearly had happened was he had there had been a post or something, and it had gone the whole length of the car, and he hadn't seen it because of the macular degeneration. And, you know, I often tell the story when I'm speaking that I would talk to my father, and my father would, like with every father-daughter, he would often resist what I had to say in these areas, and I'd say to him, do you know, Dad, that people actually pay me to tell them these things? And he'd smile and say, but you're just my daughter. And so, you know, the moral of this story was because I work in the field, it didn't necessarily solve everything, but I was very keen on not ignoring these things and addressing them in a variety of ways. And it finally was a car accident that got my father to stop driving. And after that, he was able to say that he'd had a number of situations occur. And again, hard for families to deal with, but going out and driving and looking at the car are key things we need to talk to people about. You know, there's been a lot of media attention lately about older drivers. And the truth is, what I always say to people is, getting old doesn't mean you can't drive. What does mean you can't drive is if you lose your eyesight, if you lose enough mobility, or if you lose your response time. Those are things that keep us from being able to drive. And those things do more likely occur as we get older, but they're not synonymous with getting older. So it's not about saying that nobody can drive when they get older, but it is saying we need to look for some of those other signs. And as we know, if you're like me, I love the independence of driving. I love to drive. I love to just hop in the car and go somewhere. That never changes for people. And that's the other thing we need to explain to family members, that, you know, just because you're 85 doesn't mean you're suddenly okay not driving. People hate to give that up. So as much as we don't want to see anyone lose this vital piece of independence, it is obviously worrisome and dangerous if somebody's driving skills are impaired due to either a physical ailment or lack of attention, inability to focus, whatever it is. And no one wants somebody they love to have their life at risk. And we have to also be realistic that if we don't deal with these things, we're putting other people's lives in danger. And I think that's what we need to talk with families about, that we have a responsibility not just to this person we love, but to the people in their community. Okay, so now you see on the bottom of that slide other signs caregivers can look for that demonstrate someone's having a hard time concentrating. A lack of interest in reading is one of the things. It's hard for people to read unless they can focus. Missed appointments, obviously, is a sign, and mishandled medications. Family members should look and see if there are multiple partially read books or magazines lying around. Now, this is tricky because that's, for some people, the way they read. I have a friend who often has 3 or 4 books going at the same time and just kind of moves in and out of them. However, if that hasn't been the pattern and you see that, then that's a problem. They should also look at prescription bottles, checking refill dates against the number of pills to see if they're taking their medications correctly. And they can also call the pharmacy to make sure that refills are being ordered at the right time. Now, this is tricky because we want to respect people's right to not just privacy, but to be treated like adults. So I think how we manage this with families about taking a look at these things is really key, so that we don't give a message it's okay to snoop through all your parents' things, but that this comes from a place of making sure that the person is safe and making sure that at the same time you're looking at these signs, you're respecting both their independence, their quality of life, and their right to live as they choose. I think sometimes families get that blurred, and we have to help them with that this is not their child, this is their parent. Memory loss, which can obviously be a huge issue, and it may just show up just like a little bit of forgetfulness or confusion, can be demonstrated through things like missing doctor's appointments or placing things in the wrong spot around the house, or repeated phone calls to family members at odd times. So, I used to work in a geriatric assessment clinic, and one of the things we used to say was, it's not when you forget where your car keys are, which all of us do. It's when you no longer know what car keys are for. Or, as I say to people, if you open up your refrigerator and you find your running shoes in there, that is usually a problem. So it's things being in inappropriate places. It's not running around the house looking for your reading glasses with your reading glasses sitting on your head. That tends to be just busyness and those sort of things. But having family members who understand it's looking for these kind of interesting signs of things are key. Now, the phone call issue obviously was one, and family members know if they're getting odd phone calls, both in the hours they're received and in the content of the phone call, but looking for those sort of things. Poor judgment can also include things like deciding against going to the doctor because they just went last week, even though it was with a different doctor or for a different health issue. Now, any or all these signs can cause frustration and concern, but I think what we want to say to families is they don't need to worry as much as they need to understand there are ways to cope and to get help. And I think that's the key message. And again, I want to come back to this idea that the holidays are a great time to look at this. The year that my mother had a massive stroke, and she had that stroke in the beginning of February, my parents were at my house for the holidays. And I knew my mother had a minor stroke the year before, but I really noticed on this visit that my mother was not making sense a lot. There were things going on. And, I realize now, because it was so subtle, and these were things that I kept kind of shaking my head, is that really happening, and questioning myself, I didn't push as hard as I now would do with someone to make sure they got more tests, more medical. I would have talked to my father in a different way and said, we need to get mom in and make sure everything's going okay. Those signs, I didn't realize how important they were and what they were leading to. And so I think we can help families if we can say, if your gut tells you something's not right, it's worth checking out. And it doesn't have to be dramatic. It can just be your parents acting a little strange, and they seem a bit out of character. Okay, so ultimately we want to talk about ways to take action, but we're going to talk about one last piece for families to look for clues, and that's in their parents' living environment. So let's talk about environmental clues for a minute. Okay, so you see on the screen here a list of a number of questions, and let's just kind of talk these through so you can see how families can approach this, because I think this is, again, often a key way for families to deal with this. So this takes a visit. This is not something that people can do typically over the phone. So what you can do is suggest to family that the next time they go to visit their aging parent, that they really do take a close look around the environment. If there's poor housekeeping or a lack of home maintenance, those are likely signs that something isn't right. Now, the problem we have here is we have people who've lived that way their whole lives, and so it gets harder to see those things. So it's really about looking what's out of the ordinary for this particular person. One of the places, obviously, to look, as you can see there, is the refrigerator. So taking a look in the refrigerator, the freezer, the different drawers in the refrigerator, has food spoiled because they're not eating it, or there's nothing there because they can't get to the grocery store, or if it's really messy, it could be a sign that they're having trouble keeping things clean and uncluttered. So I think those are all very, very important things for people to look at. I know when a colleague of mine, her parents were starting to show signs of early dementia, and I remember the Christmas she went home, and she said to me one of the clearest signs for her was when she opened the refrigerator and the food was so spoiled and so moldy, and her parents had no idea, and they kept telling her, no, they were just about to start eating that again. So I think, that for her was her wake-up call, was the refrigerator. And I hear that story a lot about people go home for the holidays and they're shocked by the condition of the house. Now, sometimes, again, it has nothing to do with a cognitive issue. It could simply be a visual issue. Another place to look is just top of furniture, countertops, or dishes piling up in the sink. Are dust and dirt signs that things are becoming more difficult for someone to do and they're not getting done? And also, in addition to examining what's at eye level, we really should encourage families to look both up and down. So that means checking out fans and ceilings. Is it that they're not able to lift their arms or climb up the step stools so they're not cleaning? Or there's a lot of, if they have lights home with kind of inset lights, that they're unable to now reach up and change those, and so there's a lot of lights blown in the house. And then looking down at the floors and the stairway, this is a great place to see whether or not things have been spilled. And this is something that I could certainly see when my father was having more visual issues, because he also had a bit of a tremor, and he would spill coffee or spill something on the floor, and he couldn't see then to clean it up. So I would get there, and the rug would be kind of grimy, and the floor would feel tacky, but he couldn't see it, and he wasn't aware that he was doing it. So looking at those kind of things, looking at carpets and throw rugs, various furniture, how do things look? Are they in the way? Are there a lot of hazards for tripping? That's a problem. And I think we really have to help people recognize that more and more, if they've lived in the home for a long time, the layout may not work as people age. So that's a really key consideration. And then lastly, it really is worth looking at the mail, and again, this is tricky because you want to be respectful here, but making sure there isn't a pile of bills that haven't been paid or correspondence that's not answered. So that can be a serious sign that either the person can't concentrate or there's something going on. So all of those environmental clues that we just talked about do point that something needs to be done for someone to stay independent. And ignoring those clues can lead to a real loss of independence. So what can families do? Where can they find help to move forward? Because now we've identified the problem, we want to identify some solutions. So taking action. How do you do that? Well, the first thing that we can talk to people about is sharing their concerns. Now, this depends whether the concern is ultimately physical or is it a cognitive concern. Now, if it's a concern about if someone's depressed, certainly that can be talked about. If it's a cognitive concern, the person may or may not be able to hear that, but or have the capacity to understand what's being said, and that has to be done in a way that's respectful. But I think the first key is if a family member notices something, they need to talk to their parents. And they need to talk as lovingly and openly and honestly as possible. One of the concerns I sometimes have with family members is out of their own sense of fear and concern, they sometimes come across very aggressively or very parental with their own parents. And so I think we really need to encourage families to think about their tone in this, that the fact that this is an adult and we want to respect them. They can even include other people in the conversation if that makes more sense. And often this does make more sense. So these conversations often need a third person. It could be a family friend. It could be somebody that the parent respects, like a doctor or a professional or just a friend that they respect. I think the idea is not to gang up. It's to say to the person, if you're going to talk to your parent, you have to decide, is this best just the two of you, or is it likely they'll hear it better if this is a more neutral conversation with somebody there? Now, Home Instead Senior Care has a great resource for families wanting to have these conversations. It's called the 40-70 rule, and that can be downloaded on their website and also on caregiverstress.com. And that really gives people some great clues for how to have these conversations. And 40-70 is about if the adult child is at least 40 and the parent's at least 70, there's things they need to talk about, and this gives some good suggestions for doing that. But if people can't do it alone, we want to encourage them to not ignore the conversation, but to bring somebody else into it. They probably want to make some notes for themselves, maybe list out the things they want to talk about. That can help them stay focused, and also can be shared with their parent and say, these are just some things I've noticed and I want to chat with you about. And I always say to people, if you start by reassuring someone, my goal is to support you being independent as long as possible. I want to support you having the best quality of life and the most independence, and that's why I want to talk to you about these things. That is a lot easier for most people to hear than to feel that they're being attacked. So the next thing after talking about this and expressing concern and, having this conversation in that way, really the family member should encourage their aging parent to schedule a medical checkup, especially if they've noticed physical warning signs, things like the weight loss or the depressed mood. It's important that the family member ask about follow-up visits and medications or therapies that may have been prescribed by the doctor. So, after sharing concerns, medical first to rule out any major medical issues that could be a problem. Then, as you can see, the next suggestion is, well, let's talk about a safety plan. So this is where the family gets to talk about some of the safety issues. And when they address these types of issues, there's really a great two-prong approach. First, point out the safety issue and then make a plan to address it. So if you just say, look at all these things that are going wrong, and the family member doesn't have a solution, that can be very frustrating. So going in with hey, there's some things that I've noticed that I think we could make better, and I've got some ideas on how to do that. It feels a lot less aggressive to most people than, look at this house. I can't believe you've let it get like this, which is often how people in their own fear will approach somebody. The changes could be very simple. It could be something like installing better lighting or removing rugs that can, that someone's tripping over. Might be installing grab bars in the bathroom, and I always encourage people to think about grab bars not just by the shower but by the toilet as well. And a handrail on the outside steps may be key, or a double handrail if they've already got one but it's not enough for their balance. And then if the person isn't capable of driving anymore, or they're having trouble taking care of their personal grooming, or they can't get to the store, then the family might want to think about home care services. As you know, home care services can do so much to keep somebody independent. I'm very fortunate that I was able to keep both my parents at home until they died, and really thanks to home care services, because that was the only way that could have happened. And they were fabulous with my parents. They did everything from the cleaning to the cooking to running errands to doing personal care for my mom, who required total care, to companionship, and they had to get my mother bathed and dressed and all of those sort of things. But even after my mom passed and my dad needed care at one point, he didn't need the personal care, but he needed all the other aspects of it. And I just think, I'm so grateful to those folks who came in and took care of my parents, and actually just had an email from one of them this week, and my dad's been gone about 6 years now, and telling me, about all the wonderful memories she still has of my parents, because they really did become like part of our family, and I relied on them so heavily. And we know that's true for many people with home care. Okay, then we know another possibility might be Meals on Wheels. They're fabulous in many, many communities. They differ in every community, but this idea of having regular nutritious meals delivered is key for many, many people. So I think we have to encourage that if somebody's unable to cook anymore, They're free typically with a donation. And so in every community, there's Meals on Wheels as well as meal sites, so very important. Speaking of community services, we know that the local area agency on aging in someone's hometown, it can be a great resource for help and for information. Many of them offer assessment services or assistance with sign-up processes for care, anything that might be needed. There's good information sources there. If in the end the older adult dismisses the concerns, I think we have to encourage family members not to be discouraged, that they can try again in a different way. They might want to contact the person's doctor and just express their concerns. They may want to talk to their parent about sitting down with a third party to just talk about this, such as a geriatric care manager. I think we don't want people to give up in the beginning, that it may take a few times before somebody is really, really willing to listen, but that there's a multi-prong approach to that, and it may not be one conversation going in and getting everything resolved. And then I think, again, this thing about reminding the older adult that they're coming from a place of love and concern and wanting to maintain their independence is so important. And also saying to people, by not addressing these things, my concern is that you're going to lose your independence. Sometimes for some people, that fear of losing their independence will motivate them in a way that the rest of the conversation hasn't. So I think, again, finding whatever is the way for the older adult to hear it and for us to guide families on that. In addition to talking to our clients who are the family members, I think we can also talk to our clients who are the older adults about some of these issues and say, oftentimes as people are aging, some of these things start to shift and they don't realize it. And it's very important to stay on top of this in order to maintain your independence. And we can work with them just like we work with the families and support this from both those areas, the family and the older adult. Okay, so let's now move on to talking about possible resources. So on caregiverstress.com, I mentioned before, but there are a number of articles and videos there about senior independence, and that's a great place to go and send family members as well to look. The National Volunteer Caregiving Network can also assist with caregiving services in someone's area. Obviously, Meals on Wheels, and we're giving you address for that. And then the National Council on Aging, and that's where you can look at the area agencies on aging and the local one and how to contact there as well. Okay, so those are just a few resources, and I would also add to that list geriatric care managers if people need someone to sit down with, and that's caremanager.org, and I'll repeat that later too as well if we need that. So let's talk about next steps now. Where do you go from here? Okay, so when you're thinking about these families that you're working with, one of the things I hope you'll do is to think about whether or not you need to talk to some of them, especially around the holidays, about going home and assessing their aging parents' needs. In addition, again, talking to the older adult about how to self-assess on this and being more proactive in maintaining their independence is very key. I think what resources, what the caregiver will need to find the services, also important, and perhaps to have that conversation with them prior to them going to talk to their parent, because we want them to not just go in and talk about concerns, but to go in armed with some really good resources they can discuss too, and talk about how they can assist. And then about strategies that will assist their aging parent in staying independent and ways that they can do that, about looking at both the environment and things such as additional help, and perhaps things such as exercise for the aging parent so they rebuild some strength. I think sometimes we ignore that, and we know that a lot of older adults really lose a lot of their muscle tone because they're not exercising, and it starts to interfere with their independence at a certain point. So as we say, that inability to get off the toilet, it's that kind of functional fitness that people really can regain a lot of times. So we want to not just set it up to put in things to adapt to those changes, but also perhaps to be able to regain some of the strength. Okay, so that's some of the things families can do to help keep someone independent and to be aware of shifts in independence. I'm going to now turn this back to Steve, and we're going to open this up for questions.
Thanks a lot, Amy. Great presentation.
Thank you, Steve.
And as you can see by the slide up on your screen, it is time for the Q&A portion of today's webinar. I also want to welcome to the line for the Q&A portion Mary Alexander from Homestead Senior Care. Welcome, Mary.
Thank you, Steve. I'm glad to be here today.
Great. Okay, presenters, let's jump right into the Q&A portion. Amy, a little while ago you were talking about creating a safety plan when taking action. The question is, can you elaborate a little bit more on some examples of safety plans?
Around the house, I'm happy to do that. And Mary, I also want to give you a chance here if you'd like to jump in on that too.
Sure, go ahead and then I'll jump in.
Okay, so when we look at the home, especially when you start looking at safety things, I think it's really key to go room to room and see what's going on. I started my career in home care social work, and I used to be amazed when I go into people's homes and see some of the big issues going on. And a lot of times they get missed because we kind of walk through the house without really looking, which is why I suggest to people go room to room. And the rooms that to me are some of the key rooms are the kitchen, the bathroom, and the bedroom, because if you look at these living spaces, they can often be set up in a way that can cause some of the problems. So lighting is an issue. So we want to make sure, for example, that there's good lighting throughout the house. And I think about this for people getting up in the middle of the night to go to the bathroom. Are there enough night lights? Is there enough light that they can get safely from their bedroom to their bathroom and back again? Are there any tripping hazards in that path? So the bedroom to bathroom route, for especially when people are groggy or in the middle of the night or getting up, I think that's really key. The kitchen, again, we talked about some of the safety issues have to do with food and making sure that people aren't eating food that's spoiled, but making sure the refrigerator is set at the right temperature and that it's still working. A lot of times people don't realize their refrigerators and freezers aren't working properly. It used to be that we had refrigerators and freezers that last forever, and of course that's not so true anymore. So I think we have to be more aware of those changes as well. And then the bedroom, thinking about not just lighting but throw rugs, making sure that there is there aren't hazards like the nightstand in such a place that it's a problem. I have to share that when my grandmother, who lived to be 99, in her last number of years, she lived in a very small place. And I went to visit one time and watched her, because she was usually sitting in the chair when I went to visit. She was about 95 at this point, and she didn't get up and move a lot, but she was in good health. Well, I watched her walk from the living room into her bathroom, and I was horrified because her way of getting through this house was to hold one piece of furniture after another. She really had terrible balance. And the furniture was positioned in a way that it actually blocked her walking. And I would never have seen that if I hadn't seen her walk from one room to the next. Sitting in the chair, I didn't notice anything was a problem. So those are some ideas about listing all these things out and then making a plan to fix them, whether it's better lighting, taking tripping hazards out, moving furniture around, replacing an old refrigerator or freezer if it's not working, or making sure it's set correctly. Those are all some things we can do to make the home safer.
Yeah, and I think I would add to that a couple of things that you think are pretty normal, like the microwave, which is a very large danger for some seniors. If it's up above their stove, they have to reach up. Sometimes they can't see when they're pulling something down. Hot liquid could spill on. So everyday appliances and things you need to think about. But I would also caution you that you can't just go in and say all these things need to change. These are all hazards for you. This is really about doing it respectfully, doing it with enough compassion for the senior you're dealing with, because that's a lot of change very quickly. their houses are very, very important to them. Their things are very important to them. And so you have to go in and you have to have the right finesse as you have these conversations. So it's the safety issues and the conversations that go with the safety issues that are critical.
Absolutely. And Mary, I'm so glad you said that. I mentioned that a couple times during the webinar, but it's just, we can't say it enough, honestly, because I think if we've worked with enough families, it's not that their intentions aren't good. Their intentions are wonderful, but sometimes the way they handle it feels offensive to the older adult or feels disrespectful or just makes them defensive. And I think this idea of respect and compassion are just so important. So I'm glad you stressed that again, Mary.
Okay, as always with part of these webinar Q&A portions, we like to pass on some of the helpful tips that some of the attendees send in, and here's one for you. I had a driver's training person go out with my mom. That helped a lot in knowing next steps to take. In my mom's case at the time, the trainer pointed out that turning her head more was needed. When it came from a non-family member, it was very helpful and unbiased.
Yeah, and I love that. And Steve, I just want to say that a lot of times things are easier to take from non-family members. As I, joked with you earlier, my own dad wasn't always good about taking things from me that I have said to people for years who would listen to me because I was the professional. And, my father would say, "You're just my daughter," said it in a very loving way. But I think we have to remember that it's hard to hear these things especially from your kids who, when you've been the authority figure. And I think as professionals, we need to remind families of that it can be tricky to hear that. And that empathy for different positions makes a big difference. So using professionals in a way that helps soften that is a great idea.
Yes, and also have another attendee who wrote in with a tip. iCareVillage.com is a good resource. There's personal stories and tips on there for caregivers. So iCareVillage.com, another potential resource for you. Real quick, Amy, can you remind us again the website resource for 4070?
Mary, am I right that Caregiver Stress has that on there? Is that correct?
Right. Caregiverstress.com has it, and then also directly 4070talk.com.
4070talk.com.
And it truly is a great resource. I give that resource out to families a lot because it's very practical and very simple, and you can download it for free. It's a free resource.
Okay. Next question. Here's a situation. What if family members are not ready to make any changes in the house to make life easier? How can you, as a caregiver, help them to understand that the changes are sometimes necessary to make life simpler or easier for their mom and dad?
I think we can answer this question in a lot of different ways. People come to the reality of change in different times and in different ways. And sometimes you have to start with just some very, very easily planted discussions. The kitchen's really a concern, and here's a couple things we can do to make it safer. We want to make it safer so that you can stay in the house as long as you want to stay here. So if you can turn the conversation into a direction of, we want you to live here for as long as you want to live here. We want to make some adjustments to the house just to make sure that it's easy for you to get around. So again, as long as you shift the focus to making sure that they know it's to keep them there, it's to make sure that they can maintain their independence. And I want to be really clear, maintaining independence doesn't mean a senior has to do everything for themselves. It means that everything the senior their needs are met. And so because they can't change their bed linens anymore, that doesn't mean that they can't meet that need. It just means that someone else has to do it or you have to hire services. So again, it all starts with the conversation, well-timed, well-planted conversations, but all focusing around the need to keep that senior independent, living in their own home where they want to live.
Okay. Here's another situation. What do you do if your parents are definitely not safe but are refusing help?
So they're definitely not safe, you said. Well, I always say to people, if there is truly a safety issue and they're refusing, that you may need to bring in a professional on this. And certainly Adult Protective Services is something available, in every community to report if you think there's a significant safety issue and it's not being dealt with. I would try, I always think of approaches on a continuum. So for me, it's starting with the most gentle and then moving up the continuum if something doesn't work. So if I were concerned about safety, the first thing I would try would be to engage someone my parent respected in that conversation to see if I could make a difference that way rather, than jumping right into the most dramatic solution for that. But ultimately, you have to always address safety issues quickly.
Okay.
I would agree,
yes,
sir. I think that there's one other issue that you have to really assess the issue. Are they cognitive? Are there any cognitive impairments that you're dealing with? If so, you instantly step in. I love that Dr. Amy talked about Adult Protective Services. It is a great resource, especially when there's any kind of true issue involved. If they're totally cognitive and you just don't agree with the way they're living or like the way they're living, sometimes we don't get to judge others. And so, again, I think you have to assess pretty quickly if there's any cognitive issues going on.
Okay. Another suggestion from one of our attendees, PACE programs of all-inclusive care for the elderly. PACE programs are great resources for caregivers and participants who qualify for Medicaid assistance and are frail older adults. PACE centers try to keep people in their homes. So I just wanted to pass that one on. Also, another suggestion related to driving, I've suggested negotiating with clients, retake the driving test, talk about saving money by selling your car and giving up the insurance, etc. Talk about how they would feel if they wound up hitting someone. So I wanted to pass that information on as well.
Yeah, and I would just be careful about trying to get your senior to do something based on fear. Like you usually have better outcomes when you can talk to your senior just about what's the best avenue for them and not necessarily have them make a decision based in fear.
I agree with that.
Okay, next question. No doubt that home care is a great option for helping people age in place, but often finances are an issue. What are your thoughts about how to finance home care for those folks who really don't have a lot of financial resources to pay for home care?
I think that there's this has been an interesting myth that's out there. A lot of times professionals in aging assume that they know exactly the finances of their clients based on a few things that they say. So I would say, first of all, we need to be careful that we don't just put our clients in categories where we really don't know all of the circumstances. We're seeing more and more that family members are stepping up to the plate. There's long-term care insurance policies that maybe the family knows about. There's VA benefits available not only for the veterans but also spouses. There's Medicaid waiver programs. There's PACE programs. There's a lot of different types of funding sources out there. And as professionals in aging, it becomes this, seek and find game. But I wouldn't take, I wouldn't eliminate the discussion on services without completely digging into a senior's resources and the family member's resources. Because, again, a lot of times we only know part of the story or what the senior is saying. Now, if a senior has exhausted all resources, again, there are some Medicaid waiver programs. There are some community resources. There's a lot of different areas that you can start to focus on. And the Area Office on Aging can also help with helping find some dollars for necessary services.
Okay. Do you have any insight or tips on getting early-stage dementia patients to go to see the doctor and consider the possibility of dementia?
That's a great question. And early stage is a wide range, even though it's early stage. If someone is still functioning pretty well, you can have an open, honest conversation and say, I'm concerned because I've noticed some changes, and be very specific about what the changes are. And I would just feel better if we could go take a look at this so, you know what's going on. And We know there's lots of causes besides dementia to some of that. Depression can cause some of that. Urinary tract infection, if it's a sudden change in somebody's cognitive functioning. So getting it assessed is key, and often an open conversation. Now, if somebody refuses, sometimes they will do things because someone they love says that it'll make them feel better. So I've watched many times an older adult say, I wouldn't go to the doctor for myself, but I know my husband will feel better if I do this, or my daughter will feel better. And so sometimes that will work as well. So those are a couple of ideas, and I know Mary will have others to share.
Yeah, you know what, I think, again, Amy, I think you're right on. I mean, dementia is one of those things where there's some interesting data that's come out on that, and it's usually the family members that want to know more than the patient themselves. Like, they're kind of, just doing their everyday life, and family members are noticing changes, and they want an answer. They want my mom's acting this way because she has X. It doesn't change anything. It doesn't change how mom's going to act or react to things. It just makes you feel better because you have a label on that problem. And so, and I would say that, people will go get the diagnosis in time. Sometimes they won't get it, and you're just assuming something. And so I would say that that's a really complicated discussion that family members have to deal with themselves. But again, just being honest about what you need and why you need it. If a daughter needs a diagnosis to be able to take the next step or help mom in a different way, then together mom and daughter can decide to go get the diagnosis. But again, it's more I think for the family caregivers than the client themselves sometimes.
Okay, another suggestion here. Many times adult daycare centers are less expensive than having a home health aide or companion. The senior receives a hot meal, nutritious snacks, their health and medications are monitored, and they also benefit from cognitive stimulation and social interaction. Time for...
Can I just say something to that? My mom was in an adult day program, and it was fabulous. I'm a huge believer in adult day programs, and often it's not an either-or, it's both. So someone can be getting home care and going to an adult day program. That sometimes that combination is what keeps people the most independent. So it's a very individualized thing.
Okay. Time for one last quick one here. How would you gently bring up concerns about hygiene? You were talking about that earlier, Amy. Can you talk about that a little bit?
I think respect here is really key, and gentle is a great way to say it. I know with my own father, because it's easier sometimes for me to have done this with clients than it is, again, with a family member, but I just said, Dad, I've noticed some changes, and one of the things I know about you is that you've always been really meticulous about your hygiene, about your clothes and about showering. So I came at it from a very positive place, and I've noticed sometimes lately when I visited that that's changed a bit, and I'm just wondering, is everything okay? Because I've noticed, that sometimes I'm guessing that maybe you haven't showered recently or something. It was a gentle way to approach it where I didn't, why do you smell or your clothes look dirty? It was just very gentle about telling him I knew he was somebody who this was important to, and I'd noticed some changes, and I wanted to make sure everything was okay, and did he need any help? So that was my approach to it, and it's one I've suggested to families. Mary may have another approach that will work well, too.
Yeah, I agree, Amy. I would say approach is key, and I think that having a delicate conversation and just going in really with saying something like, you know what, Dad, is there something I can do for you? Or, Mom, do you need some extra help? Or are you nervous about your bathing environment? Is the tub too slippery for you? Because there are things we can do, and sometimes it's a very simple answer. It becomes fear a lot of times. And so, again, just opening the dialogue to say, what can I do to make this better for you?
Okay. Well, we are just about out of time for today's web seminar, but I want to thank our presenters today, Dr. Amy Dupree and Mary Alexander. Thank you very much for yet another great web seminar.
Thank you, Steve. It was absolutely my pleasure.
Thanks, Steve.